I'm Alana Melanson of the Lowell Sun. We're here today interviewing Dr. Khalil Khatri of the Skin and Laser Surgery Center of New England in Nashua to talk about tattoo removal. Nice to meet you, Dr. Khatri. So now tell me a little bit about this machine and how it works.
Well, there are actually several different lasers that can be used for tattoo removal. Those are called Picosecond Lasers. This is an ND-YAG laser. We can use a ruby laser and an alexandrite laser too. They have different wavelengths. This is one of the oldest machines. It has two different wavelengths. One is used for black and blue ink. One is used for red ink. This is how we just, if that's the tattoo, we just move it along. We just treat the whole thing.
Is that a special brand?
Yeah, it's called Medlight 4. It's made by a company called Conbio. This is the CO2 laser, that's the pulse dye laser.
So do you use different lasers for tattoo removal?
Yeah, that's the only
this
one.
Okay.
Past year or two, we have a new technology that has come up. It's called Picosecond Lasers. These ones are nanosecond lasers. So picosecond is a very, very short pulse. That means the skin or the tattoo ink is exposed to the laser 1/1,000,000th part of a second. So it's a very, very short pulse. The way they work, they go through the skin and breaks the ink particles into smaller particles. And then your immune system usually clears that ink. That's why we wait several weeks in between treatments. We don't do treatments next day or next week. We wait 6 to 8 weeks before we do another treatment.
How many treatments does it normally take for your average tattoo?
It depends. There's so many different factors. Amateur tattoos are easier to remove than professional tattoos. Older tattoos are easier to remove than the newer tattoos. Then also depends what kind of ink was used, how much ink was used, how deep the ink was put in. I'm sure you have seen tattoos that they're actually raised on the skin. So there's so much ink in there. They're raised on the skin, and there's some flat. So less ink is obviously easier to remove than more ink. Then even if everything else is equal, it also depends upon the patient's immune system. Because your immune system removes the ink. So it depends upon how aggressive or weak your immune system is. It may take more treatments or it may take less treatments. There are patients that I've treated and I'm surprised that in 2-3 treatments the tattoo is gone. And then the others that I thought it would take a couple treatments and they've taken a lot more treatments. So the factor is in each treatment the ink gets less and less, and the tattoo gets less visible. So somebody could be happy with 50% improvement and say, well, I know it's fine now, it doesn't bother me anymore. There are people that, let's say 95% of the tattoo is gone, but they still see a little bit of it and they want that gone too, so they keep coming back for more treatments. So there's several different factors in there.
What's the most number of treatments you've ever had to do on one tattoo?
I think the one we have done is probably about 30 treatments.
Wow.
Yeah. This is a patient who was from Iraq, and I don't know what kind of ink they used there, and had a very different kind of colors. So we actually had to use 2-3 different kinds of lasers to remove it. And it took us several years to completely remove it. But on average, it's not that many treatments. Usually, most people do 3, maybe 6 treatments, and then they stop, depending upon what they were looking for. Sometimes they just want to make certain part of the tattoo lighter, and they can put another tattoo on it, and sometimes they want it completely removed. Typically, when people want to remove names, then they want it all gone, for obvious reasons.
Are some colors easier to remove than others?
Definitely, yes. The black is the easiest, and then blue, red. The most difficult one is green. And yellow is difficult too. By far the most difficult is green. ruby laser is easier to remove green color because ruby is red light, but it's the side effects with that specific lasers are more, and it's very difficult to maintain that laser. It breaks easily, so most people don't manufacture or sell it anymore.
So what contributes to some colors being, easier or more difficult to remove? Is it like the size of the particle, or like what is it?
It's the basic thing is the wavelength that we use of the laser. It has a specific target, and like this one here, when we use 1064 wavelength, that targets anything that's black in color. So it's also used for hair removal too. So if the hair is black, if the tattoo ink is black, this will work. 532, it targets more red color. So it's depending upon the wavelength, we target the color.
How long does your average single treatment take?
It depends how big the tattoo is. I have one patient that was treating his whole lower leg, so that will take me 15-20 minutes to do it. It's a small tattoo about this size, hardly a minute.
Oh, wow.
Yeah, it doesn't take that long, especially if they don't stop me. It also hurts when you do it. First couple of treatments you feel more because more ink absorbs more energy, so it's more painful. And but otherwise it doesn't take that long to remove.
So hypothetically speaking, say somebody gets a tattoo and they almost immediately regret it. Mm-hmm. Is there a certain time period that they have to wait before, like after receiving the tattoo, in order to be able to remove it?
Yes and no. Yes, if they have any reaction, because when you manipulate the skin, you get a lot of inflammation, no matter what you do. So if there's already inflammation and all that, you want that to settle down, which may take a week or so, and then you can do the treatment. Mm-hmm. But if they don't have any inflammation and all that, then treatment can be done.
So what sort of tattoos are you often removing? Is it more names, or is it a really wide range of different types of tattoos?
It's a wide range, but names are very interesting too. A lot of old boyfriends and girlfriends' names they want removed, but there are also some people who put their loved ones when they passed away, their names on it. I have a patient, her son tried to kill himself, I don't know, 5-6 times and wasn't successful, but the 7th time he was successful. So she put his name, his date of birth, and his date of death on her chest. And a few years later, she said, I'm recovered from that now, and I want that removed. And then we're working on that. So the different people have different reasons. I have an interesting story about that. I had a patient, she had Johnny's, Johnny apostrophe S, written on her pubic area. And she wanted that removed because Johnny was gone and Paul didn't like it. So I said, well, I'll remove it, but if you like, I can just remove Johnny, an apostrophe S there, and you can fill in whatever the name is there. She didn't like that idea.
Now, what are some of the reasons? What are some of the other reasons that you've heard for why people want to have their tattoos removed?
I think mostly people regret what they've done, but a lot of people have multiple tattoos, but they want just one specific of the two removed. One patient, she recently got a big tattoo on her flank, which is writing in there, like a quote. And then she said, well, when I was doing it, I was lying down. But when I stand up, it doesn't really show. And it just looks very bad. So she wanted removed for this one. I had a politician who, in his young age, had this tattoo done, and he was in his 60s, and said, well, I think it's time to get rid of it. So different people have different reasons to.
So what's your most popular type of customer demographically speaking?
I think they're mostly in their 30s and 40s, and at that time when their life is a little bit more settled, and then they look at themselves and say, well, I don't want this. or when they have kids, they realize that, well, I don't want my child to see the skull on my arm, or things like that, and the names of this.
What's the sort of craziest tattoo that you've ever removed?
I think that Johnny's was one,
Yeah.
and then I think I had one patient, he had octopus made that started right here, and his tentacles went all around his body. So that was a challenge.
What was his reason for wanting that one removed?
Well, I guess it was too big or something, and sometimes we don't even ask people why they want this removed. I had one patient, probably in her 40s, and she had a tattoo, I believe, on her back, and she wanted that removed. It was actually her ex-husband's name, and I want this removed because we are not together, and he is very mean to me. He threw me from the second floor through the window on the floor, and I didn't want his name on me, and he got me drunk, and he put his name on my back, and I want this removed. And I told her that we can remove it. It was very simple black ink tattoo. So. And I told her how much the cost is going to be, and then she started crying, and she said, I really want this removed because I never feel that he left me, because his name is on my shoulder, but I have no money to afford this. So I offered her, said, if you like, I will do it for free, because I don't want you to go through this pain. We also offer free tattoo removals for gang tattoos. If people have left the gangs, they have some typical signs for specific gangs. If they want that removed, we do remove those for free. If they're leaving the gang life.
How many customers like that do you see?
With the gang tattoos, very few. Very few. When I was in training in California, we used to do that. We had a lot more people there, but here it's very few.
So is it expensive to have this sort of treatment done?
Again, depending upon the size. It could be anywhere between $200 a treatment to $1,000 a treatment.
Per treatment?
Yes. Depending upon how big it is, how many colors there are.
How long have you been doing this? How long have you been in this industry?
20 years.
Wow. And what sort of technological advancements have you seen over that time?
Yeah, this is, I think, for a very long time, we just had these nanosecond Q-switched lasers. And then just past a year or two, we got this this Picosecond lasers now, which people have been working on the technology for years. But it was very difficult to build a machine that can be affordable and usable. It's still very, very expensive compared to these machines. But now we have the technology that can be put in a box. Right now, I think there are 2 or 3 laser companies making those. But yeah, still because the technology is new, so it's very expensive.
What's the difference in the time it takes between the two machines, or is it more that it's just more effective?
It's more effective for certain colors. Like it's easier to remove green color with that picosecond laser than the nanosecond laser.
So, tattoos have really exploded in popularity in recent years. Have you also seen an uptick in patients at the same time?
Yes. Yeah, I think that's true also, that there are more people getting tattoos and more of them want to get them removed too. And I think there is another trend that I've seen in the past maybe 5-10 years, that people want to remove one tattoo and get another one. So they don't want to really remove all the tattoos, but for some reason they don't like that one, or this doesn't look the way they thought it was going to look, so they want to change that and put a new one.
So, say for instance, 20 years ago, how many patients would you see, in 1 year versus now?
I think there's a huge increase in numbers, but it also depends where you are. See, if you're doing this in New Hampshire, you probably have less number of patients doing this versus Boston or New York or LA or Miami. Here people, when they do something, they kind of stay with it for the rest of their life. And people in the other part of the country, they feel different.
Mm-hmm. So how long have you been in this particular location?
I think 15 years.
Mm-hmm. So how would you say your business is doing?
It's doing good. I have 3 offices. This one here, one in Chelmsford, and one in Revere, Massachusetts too. The thing that has changed when I started my clinic here in New Hampshire, I was the only person doing lasers in the whole state. And now there are a lot of people doing this, and some are even not physicians. They're just technicians, aestheticians, beauticians, nurses, and also people who have nothing to do with the medical field. They're using it too, which is not legal, but people are doing it.
This is much safer to come to a
To
doctor.
someone who's trained, because I am not only a dermatologist, but I did 2 years of fellowship just on lasers. We still do research on lasers. I still publish on lasers. I teach about lasers. The last 2 weeks I've been in Athens and Greece and Nice, France, to teach there. Next month I'm going to India for a week to teach there. So we have a completely different background than someone who just bought a laser and the laser company taught them how to use it.
Mm-hmm. What sort of advice would you give to somebody who is considering tattoo removal?
Well, they should do some research on their own and go to a place where they're not a technician doing the treatment, but there's a dermatologist who's on site. It's easier to use the machine, but these machines can be very dangerous. They can turn a person blind because if the laser goes through the eye. And you can, if you use too much energy, you can have a very deep scar or infections. So if I teach you how to use this machine, you can use it too. But you don't recognize when the machine is causing a problem because you're not trained to do that. Or if you have a complication, you don't know how to fix it. You know, those patients, they come to us to fix the problem. So it's better to go to someone who knows the skin and knows how to use the lasers and knows how to treat the complications of it.